Welcome to episode 403, where I'm joined by Dr. Bruno Renzi, a psychiatrist, psychotherapist, and pioneer in integrating Ayurveda into the treatment of psychosomatic disorders. We explore how he introduced Ayurveda into a university clinical setting, the launch of an exciting new online course, and how this integrative approach is transforming care for conditions like stress, anxiety, and depression. So please stay tuned to learn more. Hi there, I'm your host Colette, and on this podcast I will be sharing the teachings of Ayurveda, yoga, and holistic health practices. Now, if you're new to Ayurveda, I recommend checking out the first couple of episodes where I do an introduction to Ayurveda and the mind-body types. Thanks for listening, and now here's a new episode. Before I start today's episode, I have an announcement. This August marks 8 years since I launched the Elements of Ayurveda podcast. What started as a humble offering to share the ancient wisdom of Ayurveda has grown into a global community. And it's all thanks to you. And to express my heartfelt appreciation, I'm offering 10% off of all my online services until August 6th, 2025. You can choose from online consultations, the private digestive reset cleanse, the educational self-paced daily habits for holistic health program, and my reset, restore, renew program, which combines all my services in one holistic package. Use the code ELEMENTS8 at checkout. That's Elements, ELEMENTS and the number 8 at checkout. And this offer is valid until August 6th, 2025. And thank you so much for listening, for supporting and sharing the podcast with your family and friends. I am so truly grateful for the past 8 years and excited for what's ahead. So please take advantage of this 10% offering, and I look forward to connecting with you soon. And now let's get into this week's episode. Welcome back to the Elements of Ayurveda podcast. And today I'm very happy to welcome Dr. Bruno Renzi, who is a psychiatrist and psychotherapist who created and conducted in an Italian university the first integrated medicine center for the treatment of psychosomatic disorders, integrating Ayurveda. He has been a university professor at the State University of Milan and published several books, including The Mind in Ayurveda and the preface of Volume 2 of the book Ayurveda Scientifico. Dr. Renzi is currently co-director of the Maharishi College for Perfect Health International. Dr. Renzi, welcome to the podcast. It's a pleasure to chat to you today.
It's my pleasure to be here with you. It's a great joy and to be here, and thank you.
Of course, I am really looking forward to this conversation, but I want to start with your story, talking about your personal journey, because I'm intrigued. How did your path in Western medicine unfold, and how were you first introduced to Ayurveda?
So it's a very long story. It started about 40 years ago. And at the beginning, I met my transcendental meditation teacher, and I started to meditate. And after 1 or 2 years, she told me that there was in USA, exactly at Maharishi International University in Fairfield, the first course for Western doctors in Ayurveda. And it was a little difficult for me because all my work was structured in Italy, it was structured. But I decided to go because I had the desire to change something in my life. And so I just went there. And there started a very wonderful experience, the most important, wonderful experience of my life, because I stayed there it was a full-time course. It was 1 year and 2-3 months. And then Maharishi Yogi was the organizer of this course. We had his personal attention on this course. And then he sent us everywhere in the world just to present Ayurveda. And after 3-4 months that we studied at NYU, he sent us everywhere. And so we organized about 60 Ayurveda prevention centers in the United States and Canada. And we went also to study in India, in Jamnagar, in the Gujarat state. It was a really incredible period of my life. Then, after that, I came back to Italy and I introduced the Maharishi Ayurveda in Italy in 1985. And when it was a period in which traditional medicine, it was not so allowed in the allopathic medicine, in the modern medicine. And I, with other colleagues, I started a process in which we spoke about the importance of integration, just to organize some integrated approach in the treatment of disease, because Ayurveda is very important from the prevention point of view and from the promotion of health, and also for the cure of disease. And now, after 20 years, just in the last 20 years, the WHO organization is emphasizing the importance of integration of the traditional medicine in the modern medicine system, just to treat dysfunctional disease, and mainly in the field of prevention and promotion of health, because there is a very important social and economics results if you think in terms of prevention and promotion of health. And so this is, in these 40 years, I just spread Ayurveda, and I started also to integrate the Ayurvedic knowledge mainly in my field, that is psychiatry, and also mainly in psychosomatics vision, because the concept of psychosomatics in modern medicine, it's completely different from the psychosomatic concept from the integrated point of view. So, and this is the work that I mainly made, and in this period I'm teaching just on this direction.
Wonderful. Thank you for sharing that. So you studied modern medicine in Italy?
Yes. I'm a doctor, and I have a specialization in psychiatry. I'm psychiatrist. Also, I made many other specializations in the field of psychoanalysis and transactional analysis and neuro-linguistic programming, all this. And I integrated all this knowledge in this vision that is the Maharishi Ayurveda integrated approach to psychosomatics disease.
That's what I want to get into now. And you really do have a unique perspective, of course, coming from all your studies in modern medicine and then your initial journey to the Maharishi University in Fairfield, Iowa. When was that? That was in the early 80s or?
Yes, it was in 1983.
Oh, wow. Okay. And then, as you said, then from there you went to India and you spread out to
America, in all United States. We were exactly in that course, we were 7 doctors. I was the unique Italian. And then Maharishi divided all Canada and United States in 7 sectors. And he just sent us just to inaugurate with, and we were together with Vaidya. It's an Indian doctor. It's an Ayurvedic Indian doctor. We were together, and we inaugurated, in my case, 8 Ayurvedic prevention centers in Honolulu, San Diego, Orange County, Los Angeles, Vancouver, Edmonton, and Victoria.
Oh, wow. And so you were talking to Western doctors interested in, okay.
Yes. We gave many lectures to Western doctors, and also we visit patients in that period. Just we gave consultations.
Excellent. What was back then? This is mid 1980s now. What was the reception from Western doctors then?
I think that the doctors that listened our presentation, they had some interest in this new vision or just in traditional medicine. So it was the first period that, in that period, traditional medicine is not so present in the modern medicine. It was just we were pioneers. It's correct in
Absolutely.
Yes, in that field.
Yeah, absolutely. Well, it's great that people were open to it back then, but of course, you said that was very early days. So I would love for you to talk about now psychosomatic field. You said that there is a difference between the Western approach and the Ayurvedic approach. And what inspired you to bring Ayurveda into the psychosomatic field?
Oh, because when I studied in the MIU, I understood that there was a very profound knowledge that is very different from modern medicine point of view. In the modern medicine point of view, especially in psychosomatics, they mean in the field of psychosomatics, the relation between mind and body. This is, so you have some kind of distress, you have some kind of anxiety or depression, mild anxiety, mild depression, that is common for many people. And you have some correspondent dysfunctional disease in your body. So if you have some kind of anxiety or distress, you can have some gastrointestinal problems or some cardiac problem like tachycardia or some dysfunction in your gastrointestinal or just some respiratory problem that are connected with this kind of distress or anxiety, because you have some mental state, and then you have the correspondent correspondent dysfunctional problems in your physiology. And this is the point from the modern medicine point of view, and they treat this kind of the dysfunction mainly from the symptomatic point of view. No, they don't treat the person, the specific individuality, the specific constitution of the person. If you start to integrate the Vedic knowledge, and you will understand that there are many other aspects that are consciousness, that is the basis from which everything's emerged. Then there is mind, then there is body. So and then there is also the knowledge of constitution, that it's very important, because the way in which we somatize in our physiology is connected with our specific body constitution. And this is a knowledge that is totally absent in the modern medicine. So if you have some kind of anxiety in a Vata type, it's completely different. The physiological situation is completely different than in a Pitta type or in a Kapha type or some kind of integrated Vata Pitta type or Kapha Pitta type, because there is a physiological different condition. And so you can understand very well why a person with the condition of anxiety or a condition of distress, as some people has gastritis and some other people are colitis, or some other people are some skin disease, because it's related to the constitution. And this is one point. But what is totally absent is the knowledge of consciousness. Now, in the modern medicine, maybe after 50 years, they are starting to think to this dimension. But at that time was really it was a revolution. But there is another aspect also from the psychosomatic point of view, that there is a bidirectional interaction between our cardiac brain and our mental brain. And our perception, and so the way in which we organize our internal mental representation, is due to this specific integration between cardiac brain and mental brain. Because from the Ayurvedic point of view, the seat of consciousness is in the heart. And this is true also for this new scientific field that is the wave genetics, that is ondulatory genetics. And you can see that in the heart there is a brain that, and it is the way that influence the way in which we perceive our reality. And in our heart, in that specific DNA, or in our DNA, there are some karmic memories that condition our perception of reality. And so it's completely different from the modern vision of the allopathic medicine. And when we treat a patient from this point of view, just with this knowledge, is a very holistic knowledge. It's a very holistic treatment, because we use, for example, transcendental meditation, and then we take care of that dimension that it's consciousness, because when we go deep at that level, we receive that organizing power, that creative intelligence that align our physiology with the laws of nature, and so we create balance. Then we can treat also some psychological condition of our patient, and we can treat also our physiological condition. And we can do that through the multimodality approach of the Maharishi Ayurveda. So it's a very holistic and vibrational therapy that we can use for our patient, just to create balance in that physiology. So we don't treat the disease initially, but we start a process through which we create again balance in our physiology. And in modern medicine, they treat the symptoms. They treat only so you can understand how this is completely different.
I'm really intrigued by what you said, the bidirectional reaction between the cardiac brain and the mental brain. Can you talk a little bit more about that, please?
Yes, because the heart is in connection with our mind through the hormonal point of view, through the physical point of view, just some waves some waves in the arteries and veins come to our brain, some impulse, just physical impulse. There is also a biochemical interaction, but there is also an electromagnetic interaction. And there is electromagnetic field in our cardiac brain that can influence all the different functions of our different apparatus in our physiology. So the dimension of the heart, of it's very important. And when you say you say I am I. You don't say I. No.
Yes, you're pointing to your heart. You're not pointing to your brain.
You say from the bottom of my heart.
Yes.
You say all my heart. I am telling something. You don't say my mind. No.
Yes.
No, because the real seats of consciousness are also of the individual, individual consciousness. It's in the heart. Then consciousness is everywhere, but the individual consciousness, the seat of individual consciousness, is in that brain, in that cardiac brain, that is a neurological apparatus inside the heart. And this is the new research of the HeartMate Institutes They made a lot of research in this field, and then this is what is they are developing all this knowledge.
Fascinating. And you mentioned we have an electromagnetic reaction, and you also talked about vibrational therapy.
Yes, in Ayurveda, everything, you can understand everything from the quantum. If you make a quantum jump, and then if you look at the condition of the brain, mental brain, you can observe from the biomolecular point of view, but you can say also from the quantum physics point of view, and then you can understand that in our brain there is a lot of electromagnetic fields. There is a density of electromagnetic fields, and there is a holographic reality inside our brain that is responsible for our internal mental representations. So the way in which you perceive the reality is related to these internal mental representations that are unique in you and in me and for every person. And this is due to the holographic reality that is due to the integration of electromagnetic fields, the density of the electromagnetic fields that are connected with the bioelectric activity of our brain. It is the same in our cardiac brain. So we need to make a shift from the molecular point of view to the quantum physics point of view, and then we make this quantum jump, and it's a different vision. And because the quantum reality is the first expression of consciousness, from consciousness start some vibrational dimension, and that we have there all the force field and particles, and then we have the atomic reality, and then molecular reality, and so on, the construction of our physiology. So we can observe our reality from molecular point of view or from the quantum physics point of view, and this is also present in our cardiac brain, and there is electromagnetic bidirectional communication between the cardiac brain and the mental brain, but also with all the other apparatus in our physiology. You can make balance from this point of view only with very simple technique that is transcendental meditation, because you allow yourself to be aligned with the laws of nature. And when we treat our patient, we have to create. The first thing is the very important things. The first is the evaluation of your patient, and we can integrate we are Western doctors, so also if you use Ayurveda, we were educated just to observe our patient in a certain way. But from the Ayurvedic point of view, we have three very important moments that are called prashna, darshana, and spashna. That is observation, just you observe your patient, and you will see you will receive a lot of information about the constitution of your patient. Then there is sparshana, that is the auscultation of the pulse, the nadi vigyan, the pulse diagnosis, and through that you have a lot of information about the imbalance that there is in that physiology. And then there is prashna, that is the interrogation of your patient. After that, you need to create a specific therapeutic plan for that kind of physiology. So it's very individual. It's not standardized. It's a specific observation, it's specific treatment. And so you can decide which kind of methods, of therapeutic methods from the Ayurvedic point of view, you can use for this patient. That can be absolutely, you have to change the lifestyle and the diet of this patient. Just to create balance. You can use Ayurvedic preparation. You can use detoxification with panchakarma. You can use marma therapy. You can use Vedic sound therapy is very powerful. It's our sound recitation, Vedic recitation that have a balancing influence in different systems and apparatus of your physiology. Or and you can use all this multimodality approach, and you use also transcendental meditation, and through the integration of this approach, you can guide your patient in a process of to rebalance his physiology. And sometimes it's a long process. It's not something that you have to follow him for 3, 4, 5, 6 months and maybe more, because our physiology is a little slowly in change. So sometimes you can use some very symptomatic process, but the main goal is to create balance, restore balance in that physiology, promotion of health, and educate, also make an education of the patient just in terms of prevention.
Absolutely. Yeah. Like you said, it may be a slower approach rather than giving Western medication for just the symptoms, as you said earlier. It's a holistic approach, but it's also sustainable. And I think the most important thing is that you're building awareness within the Rogi and you're empowering them.
Yes.
Yeah, through all these practices, whether it's diet, lifestyle, self-care, mindfulness.
All the different methods that can be, you have to decide what is the best program for your patient. And then obviously you need to meet some patients that follow you. That is another problem. Sometimes, because, we have some internal drivers, psychological drivers in our mind. And this is, we have that specific driver that condition our choices. And fortunately, through the transcendental meditation, we transcend and we go beyond this, and then we go in that dimension in which we can start to create a very low process of balance also from that point of view. But sometimes some patients come to you, but then they don't follow you because they have the specific orientation. And this is another problem.
Yes, and I think it's so important as well to meet the patient where they are.
Yes,
right.
They are.
And understanding what they're capable of in that moment. And as you said, it's a journey of awareness for them, because especially if they're new to this approach, it's a big eye-opening journey.
Yes, exactly. It's a great revolution.
Absolutely. I would like to ask you to explain, we're talking about transcendental meditation here a lot. For those people who are not familiar with transcendental meditation, could you explain that process for us?
Transcendental meditation is a very simple technique that everyone can learn through a process that you just meet your teachers, and your teacher give to you a preparatory lecture, and then he will present you just all the benefits of what is transcendental meditation and all the benefits of transcendental meditation. And after that, we will start. We will give you just a mantra through a wonderful ceremony in which it's a ceremony to the tradition, to the master's tradition. And after that, he follow you for 3 or 4 days just to control the if your meditation it's okay or not, and then he will give you some suggestion how to learn in the best way the meditation. When you meditate, it's a very simple thing. You just it's a sound, this mantra that allow you to transcend that level of mental activity, and very slowly you go down, and you can experience that field of pure silence inside. That is transcendental consciousness. That pure silence that is the source of everything in nature, but also of our physiology. And from that level, in that level, there is transcendental dimension, all the potential expression of all the laws of nature, and you can receive organizing power from that dimension. Just you go deep, and then you come up again, then you go deep again, and then you receive the organizing influence and some creative intelligence that start from that dimension, and this will organize your physiology in a way that every parameters of your physiology start to function in a better way, and with the practice you will establish this balance in your physiology, and if you practice regularly the transcendental meditation, you can establish that kind of pure silence inside your mind, also when you are in your normal activity. And so you have a completely new vision and a new experience, and you can experience this dimension of pure silence inside, and at the same time you can do your activity, and your reaction in every moment of your life start to change. It's a very simple technique, incredible, very, very simple. Also, a child can learn transcendental meditation, and we have program also for child.
Wonderful. It's a beautiful practice. And with that commitment of practicing TM daily, 21 minutes, twice a day, as you said, you're able to tap in to that quietness inside, the consciousness within you.
Yes, you go just to the basic dimension of your life, of your physiology, basic dimension of everything. It's the transcendental field. You go there, but it's pure consciousness, unqualified consciousness. And from there, something emerges in that rebalance your totally your physiology, not from in your apparatus, but also in your brain. And what's happened with the regular practice of transcendental meditation, you create more coherence in your brain. And this was studied from scientific point of view. There is from the electroencephalographic point of view, you can see that in the brain there is more synchronization, there is more coherence. And this coherence is related to the capacity of improve your concentration, improve your mental activity, and you can improve also your neurological function become better, and there is more creativity. All these things start to improve in your normal activity. It's a very spontaneous process. You don't just through the regular practice. And all this coherence create also, and you will realize also very quiet state in your mind. Normally, just
beautiful. Thank you for taking the time to explain that. Now, Dr. Renzi, you're currently teaching a course on the Maharishi Ayurveda integrated approach to psychosomatics and addressing stress, anxiety, and depression. Can you share with us about this course and its objectives?
I created this course, and we are now we are in the process. We are teaching the third edition of this program. We gave this for 2 editions in South America, and now we are teaching for internationally also in Europe. And in this course, we have 2 sections. The first section is the knowledge of structure and function of the mind from the Vedic knowledge perspective. And we have the great privilege to have with us in our team Dr. Manohar Palakurti, that is a very famous Vaidya, internationally famous. And he gave us all the vision of the Vedic knowledge vision about structure and function of the mind. And this is really, it's a profound and advanced knowledge in the field of Ayurveda. This is the first section. In the second section, we will offer all the scientific understanding of the concept that we presented in the first section. So we will observe all the Vedic knowledge with the possibility to understand from the scientific point of view and from the modern scientific medicine, and integrate this knowledge. And after that, we start with the treatments of distress, mild anxiety, and mild depression from the integrated approach, with Maharishi integrated approach, Maharishi Ayurveda. And it's about 7 months course. We offer 1 lecture every week, and we go very deeply in the knowledge of the mind, just using this quantum jump. Just we observe the mind, and if we use this quantum jump, if we use just this vision from the electromagnetic point of view or from the holographic point of view, we will understand very well all the Vedic knowledge related to the mind, and also we offer the treatments from integrated, but mainly from the Ayurvedic point of view, the treatment of distress, mild anxiety, and mild depression. We are talking about what you can normally see everywhere in the people. All the people have some kind of distress, some kind very existential anxiety, or some movement in the mood. So you can balance this condition. It's not for severe disease. That is another condition. That is completely different treatment. There is also treatment in Ayurveda for that kind of disease, but it's not for we just focus on the first topics. Mm. But we have knowledge also for the very severe psychiatric condition. But I just organized a course for very severe psychiatric condition. But I never offered still until now, because it's very specific knowledge for psychiatrists and psychologists.
And what kind of results are you seeing from this integrative approach with treating the psychosomatic disorders?
I was the head of a psychosomatic department in a hospital here in Milan for 12 years. I created inside this hospital in 2002 the first experience in a public institution, in a public hospital, of the integration of traditional medicine, that is what Ayurveda, with allopathic medicine in treatment of psychosomatic disease. And we treated about 1,200, in 10 years, 1,200 patients. And I can say that using this integrated approach, we observed an important improvement of health in about 70% of this patient, because, and it was a very important experience. But the main point that I wished to offer a message that was the prevention and promotion of health inside the public institutions. If you use this kind of approach, you reduce the costs inside the health systems.
Yeah, and that's a major problem today that we're seeing is the cost of disease on society. And so preventing these diseases from manifesting in the first place is where we need to start, which is what the Ayurvedic approach, of course.
We have some scientific research in which just only using transcendental meditation, that is, relax your mind, that you balance your mind, and then also your physiology change. Just only through the transcendental meditation, we have some scientific research in which we observed that there is a reduction of hospitalization and also request for doctor visits in every field of disease. And this is it's a very important research that was done in England, I think.
Fascinating. And do you think now that these public institutions are more open to integrative approach?
After 50 years, yes.
Yes.
I can say that in Italy, we have in Perugia just there's a department, a university department of integrated medicine, in which they start to teach traditional medicine and also the therapeutic methods that are considered soft medicine, like homeopathy, like shiatsu, like some other kind of, because you know that we have only two systems of traditional medicine. That is Indian traditional medicine, that is Ayurveda, and Chinese medicine. Only these two are traditional medicine because there is a corpus of knowledge very important, and that is corresponded to the knowledge of medicine. But in homeopathy or in shiatsu, they are only methods of treatment. That there is not the corpus of medicine behind. Yes,
there isn't that the Vedic wisdom we have, the classical texts behind that. What do you think happened? How did we lose this integrated, holistic approach to medicine, which did exist, obviously, thousands of years ago?
We have a problem. We have always the same problem. There is interest, as I said, from the WHO. There is interest for the integration of traditional medicine in the field of health systems in the different nations. They emphasize the importance of traditional medicine. But there is another aspect, that the company of pharmaceutical company, they prefer just to treat the patient symptomatically, they have to sell drugs.
Absolutely. Yeah.
So there is always this contrast, and there is not so much space for all this soft or for the holistic approach, because they know that if we create balance, if we create health, if we organize prevention, then the people start to stay better in a very good condition, and the pharmaceutical company, they don't want this.
The big conflict of interest.
Yes, there is a conflict there.
So you've been a pioneer since the early 80s. Looking ahead now, what projects or initiatives are you planning in the context of integrating Ayurvedic medicine further? You already have this course on the Maharishi Ayurveda integrated approach to psychosomatics. Do you have other plans in the works?
Yes. We organized a new course, but this is for general public. This is a family health course. Just give to family. In this moment, a lot of people move everywhere in the world. And there is you come from cultural tradition, and you arrive in another country where there are different habits and different cultural vision, and sometimes the family can have some difficult. And also, so we created the course just to help the family to create balance inside the family and in relation to the condition of health. And this is a course for public, for general public. It's not for doctors or healthcare professional, but can be also for them. Just to give some educational information to the normal people how to create balance and health in a daily life. And we will offer this course starting from the end of this year, always in the vision of to spread the Ayurvedic knowledge, because I personally promised to Maharishi College that my purpose in life was just to spread Ayurveda. This is one belief that there is in my mind, but also the aim is to create prevention and promotion of health. Just in this direction, we will offer this new course.
So where can listeners learn more about your work and the Maharishi College for Perfect Health International, where these courses are?
The Maharishi Ayurveda integrated approach to psychosomatics is inside the Maharishi College for Perfect Health International. But we collaborate also. When I say we, I say I and Dottoressa Garghetti and some other doctor, and Dr. Manohar also. But we collaborate also with the MERU, that Maharishi European Research University, and also with the Maharishi University for Latin America and Caribbean. And so our idea is just to offer through these institutions these courses.
Dr. Renzi, this has been a wonderful conversation. Thank you so much for sharing. And as we finish up here, is there anything that you wanted to share that we didn't get to cover today?
No, just that if someone wish to be in contact with me, you can offer the possibility just to be in contact with me. They can ask any kind of question, so about the courses or just any kind of curiosity, and I can answer. And I repeat, it's very important to proceed in this direction of promotion of health, and also to create the better condition in collective consciousness through all the knowledge, all the Vedic knowledge that the movement is doing. And our just our aim is to create a society, a very healthy society, a very happy society. And it's not so easy,
so easy, yeah.
If you look what is happened in this moment in the world, it's a critical situation. But we work for a healthy society. This means also for peace.
Absolutely, yes. When you bring people into balance, as you said at the start of the episode, you're shifting their perception of the world. And this is why we need Ayurveda now more than ever in the world.
Yes.
Yeah, absolutely. Well, Dr. Renzi, thank you so much for making the time today. I will put all the links to you and to the Maharishi College for Perfect Health International in the show notes so people can reach out, find out more about the work you're doing and the courses on offer. Thank you so much. I appreciate you and all the work you're doing in the world.
Thank you. It's a really wonderful moment to meet you and also to talk about all these topics. And thank you so much. And Jai Gurudev, thank you.
I hope you enjoyed that conversation with Dr. Renzi. So much amazing information there. And please check out the show notes for all the links mentioned so you can find out more about the new online course and more about Dr. Renzi's work. If you think that this episode will be helpful to family or friends, please share it with them so we can spread this wisdom. And don't forget, I have that anniversary discount on all my online services until August 6th. So please check out the show notes for all those details. And you can visit my website, elementshealingandwellbeing.com. If you haven't already subscribed or follow the podcast, please do so. And the new weekly episodes will automatically download for you. And if you would like to rate and review the podcast, I would really appreciate that. Please come join me on social media. My new Instagram page is Elements of Ayurveda Podcast. And on Facebook, it's Elements Healing and Wellbeing. Thank you so much for tuning in. And until next time, take good care of yourself, be well, and bye for now. Slán go fóill.